Good afternoon. Welcome to Berkeley College. Our motto is that your potential is our promise. My name is Dr. Sharon McLennan-Weir. I'm the Director of Disability Services for the college. I will be one of your co-moderators for this event titled Long Haulers, Post-Acute COVID-19 Syndrome, the Aftermath of Cognitive Disability. This presentation is co-sponsored by the National Rehabilitation Association's Metropolitan New York chapter. In keeping with universal design for webinars, all speakers will describe their appearance and virtual background. This will assist participants who have vision loss, participants connecting by using the telephone, or those participants who have a poor internet connection with getting a better idea of what the speakers look like. Thus, I am a Black, middle-aged, totally blind woman. My eyes are blue, my hair is brown, I am wearing a yellow and black suit, I am sitting in my home office, and the wall behind me has frame certificates on it. We hope to provide you with some current information and resources that can assist you with helping with vocational, educational goals and employment success for this population. Thank you for participating. We have over 630 participants who registered for this event. Registered participants are from across the country representing 50 states, and we have international colleagues from the countries such as the United Kingdom, Japan, Brazil, and Canada. Thank you so much for participating. Before we begin with our formal presentation, we need to discuss the accessibility options available for this presentation. First, all participants who registered for this event were emailed a copy of the agenda and the speaker bios. If you joined the event without registering, please email Georgia Pilling at Georgia like the state dash Pilling, Pilling at berkeleycollege.edu. She will email you a copy of the program. Second, for those participants who use screen reading technology, please note that this presentation will be muted. However, you will still be able to hear all the notifications from Zoom. Closed caption is also available for this presentation and it's been turned on already by the hosts. This webinar will be recorded. ASL interpretation in English will be available for this event. It's provided by Kyle Dewart Company. There will be 2 interpreters available for this presentation. If you want to see the interpreters, please pin the ASL interpreter view by looking for the 3 dots located next to the interpreter picture. If you have any questions during this presentation, please post them into the question and answer box. Vincent Moss and Georgia Pilling will be accepting questions during the Q&A section of this presentation. Now, it is my pleasure to introduce a wonderful man. This man believes in our students. He thinks that all students has the power to write their own story. He wants Berkeley students to achieve their degree and, more importantly, obtain gainful employment. I am so happy to introduce my friend, my colleague, President Michael J. Smith.
Thank you, Sharon. Good afternoon, good afternoon, good afternoon. I'm really fortunate to be able to welcome everybody here today to this really important conversation. I myself, I'm an older white male with a young spirit. I wear glasses over my blue eyes. Some people say they like the way my eyes look. I have most of my hair that is brown. Today I'm wearing a white shirt and a blue paisley tie, and I'm sitting in my fairly cluttered office. So Berkeley is really pleased to co-host this event today with the National Rehabilitation Association Metropolitan New York chapter. And it's a conversation about the long-term effects of COVID. And it's an important conversation. There are many of us, many in our Berkeley community, many that are in your communities, individuals that each of us know that are dealing with really the long-term symptoms that are impacting our lives and their daily lives. But the truth is at this point that we don't have all the answers. And today we have the great opportunity to really hear from a number of experts that are going to shed some light on the issue. It's going to help us understand the neurological effects of the virus and how to navigate and access the resources that are really going to be helping us deal with some of these issues. Now, we don't have all the answers because it's something that's new and something the medical community is studying and learning more about every day. But the one thing we do know for certain is that COVID is forever changing a lot about our lives. The long-term physical, psychological, emotional effects, unfortunately, are among the really troubling, lingering aspects of COVID. And we're co-hosting this event today so that those who are currently contending with the long haul or symptoms come away with a better understanding that they're not alone. And in addition to the knowledge that others are facing the same challenges, know that there are so many people and organizations out there that at this point understand what the long haulers are going through and really want to provide support. So today's going to shed some light on how we really navigate the important resources that exist and what should be utilized if you or someone is having, long hauler symptoms. The intent is for everyone to get the help they need to get back to them more themselves that it really pre-COVID. Our goal as an institution at Berkeley is really to empower our students, as Sharon said, to achieve lifelong success and dynamic careers. And that doesn't stop with academics. We do everything in our power to make sure that our students have access to the services, whatever and whenever they need it to succeed. So, this year for us at Berkeley, we're celebrating our 90th year. We've been in existence in 1931, and we have over 65,000 alumni from the Berkeley College family. Now, when you think about our start back in the 1930s, think about the immense challenges that students face then, the Great Depression, and now they face the pandemic. Berkeley was built on the idea of resiliency and perseverance. And it's who we are. It's a fabric of what we are as an institution. We're number one in New York among colleges in the overall mobility index, which really measures that when a student leaves Berkeley College, they're able to make a sustainable living. And without regard to the obstacles that students face, including COVID-19 and the long-term effects, we're really dedicated to getting our students to that graduation stage, across the stage, and into meaningful careers where they really have the ability to support themselves and their families. So today we're really proud to host this conversation because it's part of the role of higher education to serve as a public resource, a conveyor of academics and practitioners in the community to really help and share, impart important information as well as wisdom that everyone really can benefit from. So we welcome and invite any of you who haven't interacted with us before at Berkeley and the kind of conversations that we are a part of and the work that we do for our communities. We're really inviting you to come back on campus. We're looking forward to seeing you real soon. So I really want to thank our co-hosts, the National Rehabilitation Association, New York chapter co-presidents, Chris Kempsky and Wendy Hirsch for sponsoring today's sessions with us. And also special thanks to our great guest speakers, Dr. Bonnie Marks and Tracy DeFreitas. And also, in conclusion, to our disability services team for bringing these conversations to the forefront. And most certainly, and certainly not least, I want to really give a very, very, very special thanks to our Director of Disability Services, Sharon McLennan-Weir, who's curating her last event at Berkeley College today. She's going to be moving on to the role as the president and CEO of a New York City-based not-for-profit. We have been extraordinarily fortunate to have her on our Berkeley team for the last couple of years. I simply adore her. I am going to miss her terribly and know that she is going to be an outrageous, tremendous asset to her new organization. So Sharon, thank you for everything that you've done for your Berkeley students, and thank you for being my friend. With that, I appreciate all you joining us today, and I know that you're really going to enjoy this event. Thank you.
Thank you, President Smith. I appreciate your words, and thank you for always supporting all our disability events. Thank you so much. Okay, so now it's my pleasure to introduce one of our co-moderators for this event, Ms. Wendy Hirsch. Wendy has been working in the field of vocational rehabilitation for over 20 years. She currently works for Access VR as a senior vocational rehabilitation counselor. She's also co-president and board member of the National Rehabilitation Association Metropolitan Chapter. Wendy earned her bachelor's degree in psychology/sociology from Hartford University and her master's degree in rehabilitation counseling from New York University. Wendy is dedicated to working with people with disabilities, and in her current role, she specifically is working with the criminal justice population to help them prevent recidivism and reintegrate back into society with gainful employment. Please welcome Wendy Hirsch.
Thank you, Sharon. So welcome, everybody. Good afternoon. As co-president of the Metro chapter of the National Rehabilitation Association, I would like to welcome you to today's conference and thank you for attending. I am a Caucasian older woman. I'm dressed casually. I have hazel eyes, wearing glasses, have white hair, and sitting in my office at work while I'm doing this conference. So we would also like to thank Berkeley College for hosting this event and collaborating with the National Rehabilitation Association. It's been a really rough and challenging year, but due to our common commitment and all the technology available, we were able to carry on and give services to our clients. It has been challenging, but it's something that all through the pandemic we were able to do remotely, hopefully being able to serve clients in the near future personally. We've been able to place people during the pandemic, although there has been a lot of mental health issues on both parts, on counselors and clients. So this is like very, very important to us. Okay, so our first speaker is the senior psychologist in the Brain Injury Day Treatment Program at Rusk Institute. She specializes in rehabilitation psychology, traumatic brain injury, concussion, sports psychology, and mindfulness for stress management. As a senior psychologist in the Brain Injury Day Treatment Program at Rusk Institute, she offers a holistic approach to rehabilitation for people with brain injury. A member of the Association for Applied Sport Psychology, she counsels athletes at every level as well as non-athletes on an individual rehabilitation and performance goals. She also gives frequent lectures to the Rusk community on mindfulness, stress resilience, and health and wellness. She has received the Dr. Alfred Schwartz and Iris Nelson Schwartz Humanitarian Award from the National Rehabilitation Association's Metropolitan New York chapter. So without further ado, I would like to introduce you to Dr. Bonnie Marks.
Thank you, Wendy. Hi, good morning. It's still morning, right? Yeah. For some of you, it might be a different time zone. I'm not sure, but anyway, good morning or good afternoon, depending. Thank you for being part of today. Thank you, everyone. I'm 5'4". I'm sitting in my home office right now. I have blondish hair, and I guess because the norms have changed and the new middle age is 60, I'm middle-aged. So I have blue eyes. I'm wearing a dark blue sweater and a patterned blouse that's dark blue and beige. And I have, let's see, I have a golden retriever by my side in my office here named Emmett. And there's a large photo behind me of a polar bear. It's not live. So anyway, it's a pleasure to be here. Thank you, Sharon, for all you do. Really appreciate it. So I was very excited about this talk because there's so much new information and research happening around brain fog and COVID-19 and the impact on cognitive and emotional functioning. So I really appreciate the opportunity to talk a little about it. So I think we could go to the presentation. Okay, so brain fog, that's a very common term, a very popular term that you're hearing today in the news. So let's talk about, next slide will be, what is it? What is brain fog? So there's not a medical term called brain fog. It's just become a very popular name or label for it. But these are the symptoms. It's a cognitive sluggishness that's persistent. And the symptoms are, not everyone has every symptom, but some people do. So impaired concentration, impaired attention and concentration, and that's difficulty sustaining attention, forgetfulness, and I define that as short-term memory issues. Forgetfulness, forgetting appointments, forgetting dates, and so on. Also, some patients report taking too long to complete simple tasks. People say that, wow, that used to take me 5 minutes, or that used to take me 10 minutes. Now it's taking me a half hour. Could be a very familiar task, something routine. Easily and frequently distracted, losing one's train of thought, often tired and low energy, because we know that fatigue is a major factor with brain fog. Feeling fuzzy, just not clear, not on top of it, not on top of the game like you would normally feel. Sometimes it's a feeling of lightheadedness, frequent headaches, body aches, and sometimes difficulty finding the right words. Okay, next one. So what do we know about long-term COVID and the brain? We've learned over the past year and a half, there's many ways that COVID can affect and possibly damage the brain. The medical term for COVID brain is encephalopathy. People call it brain fog. Some people refer to it as COVID brain. And what do we know about it? We're still learning. We're still learning a lot about COVID brain. Memorial Sloan Kettering did a wonderful study, and they said it was cytokines in cerebral spinal fluid. And we also have had other studies like Johns Hopkins, Brigham and Women's Hospital. And they had a different study for platelets from bone marrow migrate to the brain. And then we also know that there's linkages. Different studies have shown that there's linkages to inflammation for patients who are experiencing brain fog. And then we, of course, also know that it's not unusual for strokes to occur, causing lack of oxygen to the brain, or hypoxia. We know that hypoxia is also a factor. So there's a lot that is being studied and explored now, and it really depends on. There's so many research studies now that NIH, next slide please, is giving. NIH is providing $1.15 billion in funding over the next 4 years. So we're hopeful that they will be able to pin it down, and there will probably be multiple causes of brain fog. But the research money is there now, and so we'll know more about it in 6 months, a year from now, and so on. So it's exciting that NIH has launched a new initiative. And other people have asked, well, what really is it? Well, the patients who have been afflicted by COVID, but they don't recover fully over a period of a few weeks. It's like post-COVID syndrome in a way. I call it that, but it ranges from mild to incapacitating. So there's a wide range of symptoms. And in some cases, newer symptoms arise well after the time of infection, or they evolve over time gradually. Okay, next one. As I mentioned, research is going on and happening in parts of the world, like in the UK. They've had a biobank project involving 500,000 adults ages 40 to 69 with multiple scans, detailed health information, blood samples, brain images. And this biobank started actually before the COVID infection. So now they can do studies before and after COVID infection. One of their conclusions is that COVID leads to brain volume loss and gray matter. And this is also stated in the Bloomberg opinion, which is a medical publication now. But they have found that brain volume can be affected, and also in other areas of the brain as well. The thin layer on the surface of the brain, memory formation like the hippocampus is affected. So structurally, there might be some changes. Not in every case, but sometimes it's evident. And of course, they are pinning those down in research. Increased risk of seizures, increased risk of stroke, Guillain-Barré syndrome. And we find that those individuals who have had acute respiratory distress syndrome, ARDS, exhibit a high prevalence of cognitive impairment persisting for months after discharge. And according to Barbara Wilson, at least 10% will have long COVID. Next slide, please. So we're, as a neuropsychologist or a rehabilitation professional, I'm looking at it from, okay, how does it interfere with your life? How does it interfere with work? How does it interfere with school? How does it interfere with life? Well, in multiple ways. Physical factors. The number one report seems to be fatigue, sometimes dizziness, headaches, breathlessness, other medical issues, insomnia, reduced smell, reduced taste, sleep disorders, GI issues, sometimes fever. So there's a wide range of physical factors, although I have to say fatigue seems to be very common, as well as the breathlessness. Also, emotional factors. Of course, all of these physical factors can exacerbate emotional factors. So we're addressing, as a psychologist, I'm addressing the emotional factors of fear, anxiety, depression, psychological distress, agitation, and neuropsychiatric issues. In addition, in neuropsychology at Rusk, we also work with memory difficulties, executive function deficits, confusion, impaired attention and concentration, as mentioned before. Next slide. This is the pyramid of neuropsychological functions that we use at the Brain Injury Day Treatment Center. But I really am also using it for COVID because Yehuda Ben Yeshai created it, and I would say it really makes it clear. It really clarifies neuropsychological functions, and it's at the base of the pyramid, of course, is alertness and mental energy, and attention and concentration. So therefore, it becomes even more evident that if you're having difficulty with attention and concentration, you're going to have difficulty in all the functions above that. So information processing, memory, executive functions, and higher level reasoning. So I just wanted to include this. I think it's a good visual. And if you are having difficulty in these areas, any one of them or several, then I would recommend a neuropsychological evaluation, and the neuropsychologist or the team can give you recommendations to alleviate, and also you can learn strategies to compensate for these areas, to work around these areas. So RUSC does RUSC rehabilitation in New York City. I know Dr. Goldberg, Elkanon Goldberg, also in New York City, Dr. Barbara Wilson in the UK. These are professionals who are known in the field. Next slide, please. So we also know that memory is affected. Memory quite often is reported as a serious problem, particularly, as I said before, the short-term memory. So, you know, the memory model, this is very basic, but, you know, working memory is seconds later, short-term is defined as minutes to 1 to 2 days later, and long-term memory is lifelong. Quite often long-term memory doesn't seem to be affected, but it's more their working memory and short-term memory that people report. And, you know, a breakdown in the memory system can occur when there's COVID or brain injury or stress, emotions, emotional distress, extreme stress, chronic stress. We all know that chronic stress is a big contributor to the breakdown in the memory system. Next. So taking in new information and also starting to store new information, storing the information so you can retrieve it or bring it up later, weeks later. So any one of those points can be affected when we're talking about the breakdown in memory system. And as I said, external factors as well as internal factors can exacerbate the breakdown in the memory system, including the virus itself. Also, executive functions impact your life. Higher level reasoning. This is the most advanced type of thinking that only organisms like people can do. I know my golden retriever solves is a big problem solver, especially when I hide his food and we play those thinking games. But the human being this does have higher level reasoning, of course, and which you know is covered in every area of our life. I mean, we need executive functions in order to function, no matter what we do in life. So it's the ability to develop, implement, monitor complex plans in an orderly and practical manner is our definition. It involves, you know, convergent reasoning and divergent reasoning as well. Next slide. So there are multiple areas in executive functions: problem solving, and troubleshooting, organizing, or, you know, just making a plan or organizing your day, prioritization, self-monitoring, you know, picking up on errors along the way, error correction, troubleshooting, self-monitoring. Am I on the right path? Am I on track? Am I going to complete this task today? And then mental shifting. So again, impact on life skills. It's planning your day, self-care, basic household chores, kitchen use. All these life skills are affected, can be affected, in addition to emotional regulation. If you're feeling irritable or you're in an agitated mood, it will also affect your life skills and your daily life. It in fact impacts work and productivity, school and success. Next slide. So we recommend strategies. The key to life, we feel, is strategies. You know, if you're considering returning to work after, you know, and you have long COVID, or you're improving from long COVID, you know, take some time, practice working at the computer, concentrating as long as you need to. You know, do it gradually, do everything gradually. Try to get up and go to bed at the times that you will need to when you go back to work. Practice being physically active. Practice activities that involve planning and organizing. Really try to prepare for work in advance. Prepare taking notes when using the phone. Practice your time management skills by sticking to appointment times. To make a long story short, structure your day. Next slide. We highly suggest returning to work gradually, starting at 3 mornings a week, or maybe working from home for periods of time. Return with shorter hours, take several breaks throughout the day, return with less workload, take on a different role if helpful, and volunteer perhaps if necessary. Consider volunteering until you feel back to yourself again. Next. So Barbara Wilson stated it, I thought, very well. Given the interplay between emotion and cognition and the difficulty of interpreting cognitive test results when significant emotional difficulties are also present, caution and careful analysis must be done in the clinical assessment of patients recovering from COVID-19. So, mental health and cognition overlap. They affect each other, two-way street. Depression affects cognition. Cognition affects depression. Anxiety affects cognition. All of the emotional elements, all the emotions can affect cognition and vice versa. So it's important to keep that in mind. And distractions that impact attention can be internal and external. So when we think of internal distractions, we think of negative thoughts. Oh God, I did it again, or I messed up again. Self-doubt. Can I really do this? Emotions, anger, frustration, sadness, fear, pain. And then we have external distractions, noise. Some people report being more noise sensitive or light sensitive, stressful environment, financial stress, family issues, and so on. Next one. So mental health strategies. There are many of them. I'm sure you could share quite a few with me, which I would love to hear. Go for a 15, 20-minute walk. Lift weights for 10, 15 minutes. I have weights under my desk that I lift throughout the day. Just small ones, 5 pounds. Nothing that exciting, but it's better than nothing. I stand up every 30 minutes during Zoom meetings. And also, believe it or not, people have stopped using the phone. Instead of sitting in front of Zoom or WebEx, maybe there are times when you can use a phone and then you can walk around. So the idea is movement, exercise, keep moving. Drinking extra glasses of water, it's important to hydrate. Sign up for a fun class, cooking class, language class, learn something new. And of course, set an alarm to wake up, but also set an alarm to go to sleep at night. Remind yourself to go to sleep, and maybe turn off the computer 2 hours ahead of time so it doesn't interfere with the production of melatonin. But mental health strategies are very important during this time of recovery. And everyone is recovering at some level, either emotionally or physically. Next slide. Thank you. Okay, so again, dim your computer 60 to 120 minutes before sleep. Turn it off. In fact, turn off a cell phone, iPad, or I listen to meditation like Insight Timer for sleep. But I make sure that I don't have the light of my iPad on. Practice 10 minutes of deep breathing during the day, 5 minutes of deep breathing whenever you can, 3 minutes of deep breathing. Email, call an old friend, adopt or purchase a dog or cat. I have a friend who adopted a dog and he named him Fauci. Help others, seniors, write daily reflections in your journal. And if you don't like to write reflections, write 3 things that you're grateful for every day. And that will improve mood. There's been, I think the University of Washington did a study on that. Coping strategies. participate in healthy and safe social activities, stay connected. You know, I mean, if you're vaccinated, now you are probably feeling less restricted. And, you know, just stay safe, of course, but participate, stay connected with people. Very important, either virtually or phone, however you can. Take a walk in nature. Yeah, a lot of people are doing birding. They're you know, taking photos of birds, um, and that's become very popular. Some people are becoming interested in constellations more. But just taking a walk in nature and hearing the bird sounds is so therapeutic. It's pretty remarkable, and I didn't realize on YouTube you can hear any bird sound of all these wonderful birds. Do memory building exercises, playing board games, language learning, play bridge, Sudoku. Try meditation. Insight Timer is amazing. Over 50,000 meditations for everything, including sleeplessness, anxiety, depression, performance, recovery, healing, everything imaginable. Or yoga. Yoga's on Insight Timer too. But YouTube has a lot of yoga classes, free. Next one. Thank you. Try to stay organized. This is a good coping strategy. Again, structure is always helpful because it gives you predictability, structure, routine. You can save your mental energy by doing things more routine. And then you can save your mental energy for more complex issues or problems. Try to avoid getting overwhelmed when you are forgetful, and pace yourself. You know, instead of doing 40,000 things a day, try just doing 1,000 or 5 or 10, or, you know, just be aware of your pacing now. Again, keep a reflection journal because that will help you realize what works for you in combating brain fog. Next one. Important thing is to stay connected, seek support. As the photo suggests, you know, stay connected. That's the most important thing in life during these crises. And don't be afraid to ask for help if you need it. Seek therapy. Know when you're in trouble, and seek out for help. It's actually a strength. And I have this sign in my office that I used during 9/11 that said, even heroes need to talk. So next slide, please. All right, just some my favorite quotes. I think the screen may be cutting part of it off, but we have the power to choose moment by moment who and how we want to be in the world. And it's very similar to Viktor Frankl about choice. So when we no longer are able to change a situation, we are challenged to change ourselves. And I also like Havel. Hope is definitely not the same thing as optimism. It's not the conviction that something will turn out well, but the certainty that something makes sense, regardless of how it turns out. And that's my dog, my golden retriever. He's 6 years old. His name is Emmett. He's a pet therapy dog for my whole family. But he's also, we visit the VA hospitals in Bellevue and also the schools. So he's pretty popular guy. So, and he loves, he just enjoys all the attention and the belly rubs. He'd rather have a belly rub than food. But he's just wonderful for our whole family. Next one. And thank you everyone for your attention. I deeply appreciate it, with gratitude. And that's my email. Next one, I think that's it, right? Yep. Okay. That's all, folks.
Oh, so thank you so much, Dr. Marks. Many of us have had family and friends, maybe even ourselves, who've come down with COVID. And there are changes that we've noticed. So this surely helped us understand some of the changes that we've noticed. We also have clients who've come back to us to resume services, and we've noticed additional limitations and issues. So thank you again for sharing some of the strategies that we could use to help them function in their daily lives as well as our own. So thank you again, Dr. Marks. Our next speaker is the Principal Consultant, ADA Specialist at Job Accommodation Network, JAN. She is the Principal Consultant and ADA Specialist for the Job Accommodation Network, JAN, the leading national source of expert guidance on workplace accommodation and disability employment issues, with more than 25 years of experience in the disability employment field. Tracy is one of JAN's most senior consultants. She has served the JAN organization in various roles since joining the team in 1994, including as lead ADA consultant, project manager for the Campaign for Disability Employment, an award-winning national public awareness campaign, and senior sensory and immunology specialist and team lead. She is a JAN senior leadership partner, leads the ADA team, and trains, supports, and mentors all the JAN specialty teams and employment specialists. She provides practical guidance and expert disability-related federal employment law consultation regarding a broad range of ADA issues and workplace accommodation situations. Tracy is also an experienced national speaker and published writer who specializes in ADA Title I compliance, the interactive accommodation process, leave management, and workplace flexibility. She is a graduate of West Virginia University with a Master's of Science degree in Rehabilitation Counseling and a Bachelor of Arts degree in Psychology, and has held professional certification as a vocational rehabilitation counselor and certified leave management specialist. Please welcome Tracy DeFreitas.
Thank you so much, Wendy, and thank you to Berkeley College and the National Rehabilitation Association for inviting JAN to be a part of this panel today. I am a Caucasian woman, 49 years old, with brown hair pulled up in a bun. I am sitting in my home office with an image of a white flower in a purple background and a rustic looking blackboard with lots of training written on it. So without further ado, we'll go ahead and talk a little bit about long COVID and the interactive process. Vincent, we can go to the slides. Jim was invited to talk today about post-COVID conditions and the ADA interactive process. So I'm going to tell you first a little bit about the Job Accommodation Network on the next slide, so you know where I'm coming from and why I'm here to talk to you about that interactive process. The JAN service, on the next slide. Oops, back one word, there you go. So JAN it's a national free consulting service that was established in 1983. We've been around for quite some time. And for those of you who are in the US, we're a service that you can take advantage of in order to receive expert consultation on job accommodation solutions related to all types of impairments in any industry you can imagine, in any job category you can think of. We provide targeted technical assistance on the Title I employment provisions of the Americans with Disabilities Act, and also on Section 501 of the Rehab Act, which applies to the federal government. We're located in Morgantown, West Virginia, but we do serve the entire country. We do sometimes receive contacts from people in other countries as well. We're funded by a contract with the Office of Disability Employment Policy through the US Department of Labor. And we are not a federal agency, but we are funded through that federal agency. but we're here as a service to anyone who has questions about reasonable accommodation in the ADA. For those of you who might be individuals with disabilities, individuals who might be experiencing the effects of COVID, having long COVID, or if you're a rehabilitation professional who might be supporting an individual and returning them to work or keeping them working, we're a resource for you, as well as employers. So if you have an individual who's requested accommodation, we can be a resource to help you. For more information about the JAN service, you can visit askjan.org. That's askjan.org. Next slide. So we're here to talk a bit about long COVID, and Dr. Marks did an excellent job of talking about the effects of COVID on cognitive functioning. We at JAN are certainly hearing a lot about people who are affected in various ways after having had COVID-19. If you have post-acute COVID-19 syndrome or long COVID, some people might be thinking, what now? What does this mean for me related to work? And so you have to really consider whether you have limitations that could affect your ability to work in some way. And if you do, some things you want to keep in mind. It's important to learn about the Americans with Disabilities Act, or the ADA, and whether the law applies to you. The ADA, and I'll give some basics on that in just a second, but it might be a law that would afford you the possibility of changes, adjustments at work, reasonable accommodations that might help you address some of the limitations you're experiencing in terms of performing job duties. And so it's important to take a look at the ADA as a way to sort of leverage your right to ask for some adjustments at work based on the effects of COVID-19. You want to consider disclosing your medical condition and requesting reasonable accommodation. I think for a lot of people who are dealing with the effects of COVID, they might not know exactly how it's going to affect them at work, or they're just sort of learning how the impact of limitations might affect them at work or to work. And so you have to consider for yourself when it might be the right time, if ever, to disclose that you've had COVID-19, that you might be experiencing symptoms as a result of long COVID, and how those symptoms might affect your ability to do the job, and whether or not reasonable accommodation could make a difference for you in terms of successful employment outcomes. I think it's also important to access available resources to support the interactive accommodation process. And I'm going to explain what that means here in just a minute. But basically, JAN and other resources can be available to help with that interactive process, mainly to explore possible accommodations. Dr. Marks actually did an excellent job of also laying out some strategies for coping with the effects, the cognitive and the mental health related effects of COVID-19. But also know that some of those strategies actually transfer very well into accommodation ideas at work. So I think it's important to consider that. So those were some really, really useful strategies. Next slide. So in order to leverage the ADA and to engage in what we call that interactive process under the law, you have to know a little bit about what the ADA is. Title I of the law, it's a federal civil rights statute that removes barriers to equal employment for individuals with disabilities. It applies to private employers who employ 15 or more employees, as well as state and local government entities. The law prohibits disability-based discrimination in all employment practices and in every stage of employment. And it mainly requires reasonable accommodation when an employer knows about the person's disability, their limitations, and how those limitations affect their ability to work. And also when the individual's made it known to the employer that accommodations might be needed. Finally, the law also it has an undue hardship component. So what that means is that there are some accommodations that might not be considered reasonable or might create an undue hardship on the employer. So an employer is not expected to make those kinds of changes if they do, in fact, create an undue hardship for the employer. Next slide. So consider long COVID in the ADA. So the question is, is post-acute COVID-19 syndrome or long COVID an ADA disability? So we have to keep that in mind because the law applies to individuals who would be characterized as meeting the definition of disability under the ADA. So not just an individual who has limitations will necessarily be covered under the law. You do have to meet a definition of disability. But right now, we're not really certain whether or not it's considered a disability. Keep in mind, there is no comprehensive list of impairments that are always considered a disability under the ADA. It is something that has to be considered on a case-by-case basis. It is important to take a look at each situation and consider that the definition of disability at this time is interpreted in a very broad way. And so, ordinarily what we would say is to not get too hung up on that. And I'm going to talk a little bit more about that in a second. But what we do know is that some people may have difficulty working in the same way they did before they had COVID. And so as a result of that, we know that there is that underlying impairment of having had COVID, which now might result in long COVID. And we know that it's possible that individuals could have significant or severe limitations as a result of having had COVID. Even though some of those limitations might be temporary in nature, it is possible that they might be severe enough. They might affect their ability to perform certain major life activities in such a way that it's severe enough that it's possible that having long COVID could rise to the level of a disability under the law. Jan offers a number of resources on these topics. And so throughout my slides, you will see some starred resources. The links to these resources are included at the end of the PowerPoint, which I think will be provided to everyone. Jan's COVID-19 long haulers and the ADA is one resource that addresses some of these ADA questions that come up and requesting accommodation if you do in fact have long COVID or if you're supporting someone who does in that rehabilitation process. Next slide. So what can you do if you think you have an ADA disability as a result of having long COVID? Well, if limitations are affecting your ability to work, you want to consider requesting reasonable accommodations because it's possible that those accommodations might make it so that those limitations don't have a significant impact on your ability to work. Making accommodations, those adjustments, changes in how the work is performed can oftentimes enable somebody to perform the essential job duties when those limitations do have an impact on work. You might not think of yourself as having a disability necessarily. And I think, that's true for some people with a disability even. They may not really consider themselves to be someone who has a disability. But I think it's important to consider how the ADA could apply to you if you have a medical condition and your limitations significantly impact your ability to perform major life activities. And that's where we get to that ADA definition of disability. So someone who has what we would consider an actual disability, which is the first prong of the definition of disability, is someone who has a physical or mental impairment that substantially limits one or more major life activities. This is someone who could be entitled to reasonable accommodation under the ADA. Someone who has a record of such an impairment might also be someone who's entitled to reasonable accommodation under the ADA. So it's very possible that based on the limitations you're experiencing or the severity of those limitations, it could be an ADA situation. Regardless, employers are certainly free to provide accommodations even if someone doesn't meet the technical definition of disability under the ADA. So what we would typically tell individuals or rehab professionals is don't get too hung up on that definition. If someone knows they're having some limitations in performing job duties, go ahead and talk to the employer. Consider asking for some modifications. They may or may not look at it as an ADA situation, but they might still be willing and able to make some adjustments in order to help you maintain employment, return to work, and succeed on the job. So really kind of keep that in mind. Next slide. When we're thinking about requesting an accommodation, you have to know what that means. And under the ADA, it's when an applicant or an employee asks for an adjustment or change at work for a reason related to a medical condition. So there's a nexus between medical condition and a work-related barrier. Once those two things come together, that's considered a request for accommodation. The law does not require that the request be something that is written, although it is something that we would recommend because it's always a good idea to document that you're requesting an accommodation or anything that you're requesting of your employer. It can be submitted verbally or in writing. So we know that that's true, but that written request is something that is recommended. It is something that can be requested through a supervisor, manager, human resources. There's no specific person or entity that an individual must request an accommodation through, but you want to do it through someone who can act on that request. So if you're an individual, it might be with your current manager. If you are a rehab professional supporting someone and returning to work, you might encourage them to go through human resources to do that. But once this happens, once this request is made, it does what we call triggers that ADA interactive process. And what that means is it triggers the employer to engage in a conversation, in a collaboration with the individual to explore possible reasonable accommodations. Of course, the employer first has to determine whether the ADA applies and accommodations are warranted. But it's a collaborative process. It's a chance to work together to come up with a solution if there's a work-related barrier. So that process is triggered by your request for accommodation. Jan offers some resources to help you through that process, or to sort of initiate that process. Two that we offer in specific to requesting accommodation is the Employee's Practical Guide to Requesting and Negotiating Reasonable Accommodation. And then also Jan's How to Request an Accommodation, which is sort of an outline of some of those things that you want to consider when you're writing a request for accommodation. Next slide. Now, when this is done, as I mentioned, it does kick off, it triggers that interactive process. Under the law, there is no formal process. We do know that it's expected that employers go through this process once someone requests an accommodation. But a lot of times employers create their own policies and procedures around that interactive process. It oftentimes includes steps like those here on the screen. The first one being recognizing an accommodation request. Second, gathering information. Third, exploring accommodation options. 4, choosing an accommodation. 5, implementing the accommodation. And 6, monitoring the accommodation. This is a process that Jan has created, and a lot of employers do model their interactive process after this particular process, but it just really breaks things down in a real simple way to kind of lay out that collaborative process that needs to occur once someone requests an accommodation. For more information on that, you can go to askjan.org through to the A to Z section under topic interactive process. So if you'd like to know more details about that specifically, please do go there. I'm going to sort of break down just a few tips related to this process because we have a short bit of time today. On the next slide, you do want to consider some sort of practical suggestions related to that interactive process for individuals. On the next slide. Sorry, I think we need to go back one. There we go. Practical guidance for individuals. So when you're thinking about requesting an accommodation and moving through that interactive process, there are some things to keep in mind as an individual. Also as a rehabilitation professional who's trying to assist that individual making the request. Of course, it's important to know your ADA rights and to document your request. So I think it's something that an individual needs to do, and that's to become familiar with your rights under the ADA. You don't have to be an expert, you just have to know a little bit about the basic requirements and how to go about making that request for accommodation. I think it's important to approach the employer with accommodation solutions if you can. So, rather than just simply go to the employer with the I can'ts, it's important to go to the employer with this is how I can do it with these adjustments. It's also necessary sometimes to provide medical information to support that accommodation request. For those who are experiencing the effects of long COVID, it might be important to offer information about specifically what effects you are experiencing, whether they're cognitive or physical, emotional in some way. It will help the employer to understand how your limitations will affect you in doing the job. You also want to use available resources and work collaboratively with the employer and those resources to explore effective accommodation solutions. So remember, it's a process of working together and really kind of reaching out to those who can help, like Jan, for example. You can be open to trial accommodation solutions. I think that that's something that we really need to keep in mind because for a couple of reasons. One, it might be that the effects of COVID-19 or that the long COVID related limitations could be temporary. They might not be, but you just don't really know moving forward. Regardless, I think oftentimes employers are more open to providing accommodations if we can offer a trial option to see whether it works, to see whether or not it's going to be effective in enabling someone to perform the job duties, and then also to ensure that it's something that's reasonable and doesn't create an undue hardship. So that idea of a trial accommodation can be something that is very appealing. It's also important that if an accommodation's been implemented, that if it's not working, to let the employer know. So make sure you kind of come back and evaluate things and determine if it's something that's effective in enabling that person to perform the essential job duties or to access a benefit or privilege in some way when disability prevents that. Next slide. So what if it's not known what accommodation is needed or whether an accommodation will be effective? That's okay. That's part of exploring accommodations in the interactive process. And so what might be needed is to share some information about what's known about the impairment that you're experiencing, the limitations involved, and of course the job-related issues. And then from there, you can work together to collaboratively explore with the employer ideas for performing those job duties. And when it comes to accommodations, they'll vary, but it's about engaging in that process and working together. It's possible to contact Jan or other resources for assistance in that process as you're exploring based on knowing what the job tasks are that are involved and what effects of long COVID you're experiencing. Jan offers Jan's Accommodation and Compliance Coronavirus Disease 2019. So this is our COVID page. And what we've been doing throughout the course of the pandemic situation is adding resources to this in a timely way to address specific issues around accommodations and COVID-19, as well as those for, who may be long haulers. So it's important to kind of go back to that page every now and then to look for the latest information. Next slide. When you're exploring accommodations, you do want to consider what long COVID related limitations the person is experiencing. And of course, as Dr. Marks mentioned, she talked about shortness of breath, extreme fatigue, brain fog. I mean, some of those are really some of the most common limitations that we are hearing about. It might also be insomnia, tachycardia, joint pain and body aches and headaches. So these are all limitations that could certainly affect an individual in performing various job duties. These are the most common. There might be others, but these are the most common we're hearing about at Jan. For information related to these types of symptoms and accommodations, one resource you can turn to is our Accommodating Employees with COVID-19 related symptoms. Of course, this could apply in the long COVID related scenario as well, because we know those who might have COVID-19 might experience some of these symptoms, but then also from the long haul standpoint might have the very same types of symptoms moving into a longer term scenario. Next slide. And it's important to keep in mind that not everyone is the same. Everyone is going to experience different limitations. And so you want to ensure that you're treating each individual on a case-by-case basis and looking at the accommodation needs they might have. Accommodations can vary depending on the specific limitations and the job tasks. So when we talk to people about exploring accommodations, it's really important to know, what are they trying to accomplish at work and where are they having those limitations? Various accommodations could be flexible scheduling, rest breaks if needed, related to whether it's brain fog or whether it's related to fatigue. It could be reducing physical exertion where that's possible. Job restructuring to remove what might be marginal duties or how and when essential duties are performed might be ways to accommodate. And that again could apply in cognitive related situations where it allows that person to focus on the most important tasks of the job, or in those that are more physical in nature as well. It could be using alternative mask options if masks are still required in the work environment and someone is having some difficulty with shortness of breath. It could be reducing triggers that could create respiratory related symptoms and allowing time for treatment of those symptoms. uninterrupted work time where somebody can schedule a period in the day where they're not interrupted by having to address emails or phone calls or attend meetings could help with cognitive limitations. Memory aids, noise canceling to help provide a quiet environment when you might have limitations in space and you're not able to create that quiet space very easily. Of course, telework can be a good solution for some, but not all. Some people really do find that they're able to concentrate and remember and prioritize tasks well from home, but others do find that that creates some isolation that can create some difficulty for them in terms of focus too. So you really have to look at it case by case. Ergonomic equipment could come in. So if someone is dealing with issues of fatigue or body aches and joint pain, you want to ensure that they have an appropriate ergonomic setup in order to work as well. There are lots of ways that we could go in terms of accommodations. So it is something we really have to do on a case-by-case basis. We have a short bit of time today, so I just wanted to cover just a few things for consideration. Some relevant resources around accommodations, other than those I've already mentioned, include Jan's accommodation solutions for executive functioning deficits. So if someone is experiencing some difficulty with memory, prioritizing, planning, time management, focus, things like that, we have an excellent publication that addresses accommodations specific to those types of limitations. And then, of course, you can always go to askjan.org by A to Z to look at limitations, types of accommodations, and also types of impairments for more information. If that fails and you're not quite sure what you're going to find there, or if you haven't found what you're looking for, you can contact Jan and talk to us directly about some solutions on a case-by-case basis. And I'm nearing the end here. One more slide, I think. So if you are interested in contacting us, you can certainly do that. I encourage everyone to go to askjan.org to the homepage. There you can also find all of our contact information. Right now, the fastest way to get in touch with somebody is to use the live chat feature on our homepage. You can also email us or leave a voicemail message, and of course, follow us on social media as well. We'll go one more slide, and then I will go ahead and turn it over. Just to let you know on the slides that follow, and Vincent, you're welcome to walk through these if you want to, but just so you're fully aware, we do have some resources on these slides related to those that I mentioned and some additional resources that you can link to directly. These are resources that Jan provides, and then I have also included some excellent resources from the Equal Employment Opportunity Commission, EEOC, which is the federal agency that enforces the Americans with Disabilities Act. They've done a really excellent job of keeping up with the issues that have developed in the work environment around COVID-19. They have a technical assistance document, the What You Should Know document listed at the end of the PowerPoint. That is a great go-to if you're looking for information about the ADA, how it applies, and how to support those individuals that you're working with. So with that, I will go ahead and leave it out on the table, and we can go to questions, I think.
We're going to go to Paula.
Thank you. I hope everyone can hear me. Good afternoon. I'm Paula Lee from the New York University Wasserman Center for Career Development. I just want to say thank you to Tracy. Great feedback and information about accommodations. And Jan, I know you've been a longtime supporter. You've spoken to our chapter in the past. So again, thank you for your thoughtful comments. So again, I'm Paula Lee. I am an Asian middle-aged female. I have dark brown hair with brown eyes. Right now I'm wearing a red top and I'm working from my home office in my living room. So without further ado, I want to just give a little background information and I'll introduce our next speaker. I am a certified rehabilitation counselor. I have been past president of this chapter, and I've been involved not only with career development, but also in the disability space for the last 30 years. And I'm just very grateful that we were able to offer this event today. So without further ado, our next speaker is Dr. Sharon McLennan Weir. I think you met her earlier in case you joined us late. Dr. Sharon Melise McLennan-Weir has been working in the field of rehabilitation counseling and mental health for over 20 years. Dr. McLennan-Weir received her PhD degree from Seton Hall University in counseling psychology in 2012. She obtained a U.S. Law and Methodology certificate from New York University School of Continuing Education in 2003, her MS degree in rehabilitation counseling at Hunter College, CUNY in 1998, and her BS degree in biology from Syracuse University in 1993. Dr. McLennan-Weir is a certified rehabilitation counselor and a New York State licensed mental health counselor. Currently, she works at Berkeley College as the Director of Disability Services for New Jersey and New York campuses. She is dedicated to providing training and presentations regarding psychological topics associated with the aspect of disability. She has published several articles and book chapters regarding this subject matter. In addition, she served as the rehabilitation professional community by her service to the National Rehabilitation Association's Metro New York chapter. She is past president of the Metro New York chapter, NRA chapter from 2001 to 2002, and was the co-chairperson for exhibits of the Northeast Rehabilitation Association conference held in New York in 2003 and 2013. I know that's where I'm supposed to end, but that's not where I'm going to end. I just want to give some personal background information. I know that Sharon is ending her days at Berkeley College and moving on, but I've known Sharon for approximately 20 years, and just what a marvelous colleague and friend she has been. She has worked in many areas in disability and rehabilitation, and she only gets better with time, like fine wine. Like many of us, Sharon has had many challenges over the years, but she does not slow down ever. She gets up, brushes herself off, and is ready to move onward and upward. Indeed, Sharon is unflappable and is our present day, the unsinkable Molly Brown. For those of you who do not know who Molly Brown is, Molly Brown was called unsinkable because she survived the sinking of the Titanic in the year 1912. So she survived, but not only that, she helped in the rescue of fellow Titanic passengers by urging her lifeboat to go back and rescue even more passengers. And in 1960, the musical, The Unsinkable Molly Brown, even opened on Broadway based on Molly's life story. So I just want to now present to you our unsinkable Sharon McLennan-Weir. Thank you.
Thank you, Paula. That was wonderful. I do appreciate that. I just want to thank Dr. Marks and Mr. Freitas for your wonderful presentations. For the sake of time, Vincent, we're going to roll to slide 5 and start with stigma. My presentation is really going to be on the psychological impact of adjustment to disability. For many folks that have dealt with not having ailments or not having the change of life, you know, you were considered able-bodied, and now you've had COVID and you're now a long hauler. It's quite a psychological adjustment to how society is going to treat you with a new label. I want to tell you that, yes, stigma is a very strong word. It's a horrible word because you feel that you're not good enough to compete in society. But I have to tell you, a lot of what stigma is about is fear. When we look at stigma with regards to COVID-19, a lot of it is just not knowing what's the expectation is going to be. You could be in a place, public place now, and perhaps you're in a restaurant because you're going back to doing things in public, and you may hear someone that coughs, and you probably just have a startle syndrome. What you have to keep in mind is that we don't really know who's vaccinated, who's not, and we don't know what other people's situations are. However, we do know that we're all individuals and we need to be treated with respect. And we do know that as individuals, we really want to achieve the same dreams and aspirations like everybody else. We want to have a job. We want a gainful employment job. We want to have opportunities to have a family. We want to have opportunities to engage in sex. We want to travel. We want to have friends at work. So stigma can be ugly because with stigma, that prevents us from actually obtaining those goals and aspirations, okay? We also know because of stigma, many groups, racial and minority groups, have been discriminated against during COVID-19, including Asian Americans. And it's important for us to understand that COVID did not discriminate based on race. COVID affected every single person. The virus attacked every single person. The virus reacted in people's bodies differently. However, it still affected every single person. So it's important for us to understand that as we recover, it's important that we look and listen to the individual and hear what he or she is going through. Next slide, which is slide 6. So let's talk about the psychological impact, okay? Because whenever we hear the word disability, yes, we know what the law says. It's an impairment that substantially limits a life activity, and it could be a physical or a mental impairment. However, most people that hear the word disability says, oh, sugar, I don't want that. That's not what I want. Why do I have it? Woe's me. So we start to see the feelings of shame, isolation, stress, guilt, low self-esteem, and your levels of self-confidence starts to diminish. It's important for you to know that this is quite normal. It's okay for you to have the initial shock that one day you wake up and you can't remember and you're like, I remember that yesterday. Why can't I remember it right now? It's important for you to know that there are ways to cope. There are strategies and techniques to survive. And I think that's the main thing that I want to address to you today, that yes, we don't know when COVID long hauler effects are going to end, but we do know how to manage those symptoms and how to manage your life so that you can live and enjoy things a little bit better. You have to understand that your quality of life is going to change. The way you interact with your family, how you make your appointments, what you do for your job, how you go about navigating, going to the grocery store, driving. Maybe you can't drive. Maybe you need to learn paratransit services or take your Uber. Things are going to change. Doesn't mean you can't do the things. It's just that you're going to have to alter how you do those things. You have to understand that, yes, you're going to worry about money, because the true facts of finances for people with disabilities is that people with disabilities have the lowest economic status in the United States. And it's not because people are not educated and they can't work. It's just that sometimes because of whatever the disability is, it limits you in trying to get gainful employment. So understand that you're going to have to figure out what your accommodation needs are. You're going to have to figure out how you best work. No one else is going to know how you best work but you. You need to figure out what are the coping skills that you're going to need. Are you going to need a service animal to help you get to where you are because you need more self-confidence? Are you going to need assistive technology to help you? Are you going to use your phone to use organizer apps? Are you going to ask a friend for help? Are you going to ask your employer that, you used to work from 8 to 4, but now you think you have to work from 12 to 8 because the fatigue is just so bad in the mornings, but as the day goes on, you're able to manage. You have to understand that because it's a hidden disability, that people can't see it. They can't see your memory, they can't see your fatigue, and they can't see that you're not attentive the way you used to be, that you're gonna have to be your best reporter of what you can do. We don't want people to assume you can't do it. We want people to know that you can, but you have to do it in a different manner. And you're gonna be your best historian in describing how you go about doing that. You also have to understand that society is built on an able-bodied premise. So I would like to say that the able-bodied environment is handicapping to the person with a disability. However, if we create a barrier-free environment that person with a disability can excel in all their dreams and aspirations. Next slide, please. So the psychological implication of adjustment can also lead to psychological disorders. Because of that initial shock of I have a disability, the stress can also cause psychological disorders where you may have depression, anxiety, stress. So this slide shows that in the US population, there are a lot of psychological disorders that are listed. It's important for you to understand before COVID-19, we had a great incidence of psychological disorders in the United States. However, now COVID-19 has still here, the increase of psychological traumas even further. So for those long haulers who now had a new diagnosis of cognitive deficits and they don't have the resources to deal with it, we are concerned that on top of that, you are going to also acquire a psychological disorder of depression or anxiety. So it's very important for you to understand that you could have those type of issues. Okay, next slide, please. So what are the things that you need to look for? What are the signs that you need to look for if you're having psychological trauma? You need to recognize these symptoms and be mindful that you're experiencing them. You're not imagining it, you're not going crazy, you're having these symptoms. So feelings of numbness, disbelief, you're confused, you're not really focusing the way you used to. Anxiety, you know, some people talk that they never had a panic attack before, and all of a sudden, because of the long hauler effects, they're having panic attacks. Fear. I think that's the biggest complaint a lot of our students have said to me as they apply for services, is that they're so afraid that their body is not going to be the same again, that they're not going to be able to deal with, you know, trying to complete their degree here at Berkeley and getting a job, because they just have all these cognitive deficits that they've never had before. Also, some physical symptoms like changing of your appetite. Some of our students talk about eating too much or eating too little. For the students that talk about eating too much, it's quite stressful because they also may have incidents of diabetes or other type of heart disease complications, and they really can't put on the weight, but they just don't know how to stop. Their energy levels are so waned because they used to be able to stay up all night and study for an exam, but now they can't. And their grades, they see their grades are being affected. They try to reach out to their faculty members to get additional time for things. And some of our professors are really, really great and able to do that. But a lot of them who are unable to do it, they know that they need to direct them to the disability office to get accommodations. And we really, really try to provide temporary accommodations for students that are experiencing COVID-19 and long haulers. Concentration is a huge complaint that a lot of our students complain about. And the biggest thing is the attention. Being able to sit in a Zoom session for 90 minutes can be very challenging, or just being able to sit in a Zoom session for 10 minutes. For some students, they say that their level of attention is just not the same. You know, they're listening to the professor, and then within 5 minutes, they're just lost. And they don't understand why that is. I think the first thing that's important to understand is, first of all, that you're not imagining these symptoms. You do have these symptoms. And also that there is some recourse for the symptoms. One of the biggest things that our students complain about is the sleep disturbance, that they can't sleep, or if they do sleep, they're having a lot of nightmares and they don't feel rested when they wake up in the morning. they have headaches, and they're worried about it because some of our students are managing multiple activities. They have children they have to take care of, they have jobs that they have to respond to. A lot of our students are typically those first responders, or they're in jobs where they couldn't work from home, they had to be on the front lines. So that level of pressure of worried about being exposed is also further heightened as well. So, there's a few more things on this list, but the main thing that there are a lot of physical symptoms, rashes, things like that. But also, I think the most biggest thing that our students talk about is the irritability, their mood, and the way they have exchanges with people. So for the faculty that is here at Berkeley, and also the faculty across the country and the world, I want you to, first of all, I want to thank you for your patience as we work through with our students. But understand, if you're having a student who had long haulers, who have been affected by COVID, their level of self-regulation, their irritability is very heightened, and they may be sarcastic or short with you. And it's not necessarily that they are disrespectful to you. You may see it as that, but we need to understand the context of where it's coming from. For some of these students, they really, really can't help it because of the COVID symptoms, on top of the level of psychological stress and what's really happening to them overall. Okay, Vincent, I know I'm running out of time, so let's jump to the remediations. So let's go to, sorry, because I want to get to questions. So I'm going to jump to what we're going to do, interventions.
Okay.
So we'll talk about the psychological interventions. There's a lot of information in my presentation, and if you guys want it, you can reach out to me. I talk about how COVID have affected employment for people from minority backgrounds and so forth and so on. But let's talk about how we give some remediation to our students and to our clients. So I think Dr. Marks hit all the main things on this slide. But I just want to highlight that these therapies are very important. I think the first thing that we should really talk about is that, first of all, you have to take care of mental health issues. Yes, we can get treated for COVID. There are treatments for COVID. However, one of the things that people forget about is that they don't get treated for the mental health aspect of COVID. So I implore all of you, if you are having symptoms of anxiety and depression and just not feeling good about your mental space, to really pursue mental health counseling. There's a lot of services available, low fee as well as fee for service, as well as different clinics throughout where you live. So don't make money be a reason why you don't get mental health services. There are a lot of medications. Medications doesn't work for everyone, but for some of our clients who've been have not address their psychological issues for a long period of time, medication coupled with psychotherapy is recommended, because sometimes if you haven't been addressing your psychological needs, just talk therapy alone is not enough. So there's different antidepressants, different anxiolytics, mood stabilizers, antipsychotic drugs that could work for you in conjunction with cognitive behavioral therapy. It's important for people to know that if they're having a break, a psychological break, there's different hospitalization programs, partial hospitalization programs, inpatient, outpatient programs that are available that you should really try to pursue. There are different types of creative therapy, like music therapy, art, drama, video therapy that also can be very effective in conjunction with medication management and CBT. You need to have lifestyle adjustments like peer support groups. So there are long hauler groups throughout the country of people who are experiencing the symptoms of COVID-19. And sometimes if you're able to talk to someone who's experienced what you're going through, you can learn strategies and coping skills. And also it helps with that removing of that isolation. To have someone that you can go to a Zoom group once a week at a certain time, and they can understand your struggles and give you suggestions to help you. There are books and self-help groups that you can go to, especially if you're experiencing a psychological disorder like depression, anxiety, and so forth. There are specific groups within your area. You can just Google like depression or anxiety, put your zip code in there and see what self-help group comes up. Dietary supplements. So I like to say vitamins is really, really important. One of the biggest things that we notice with minority folks, you're typically not having a lot of vitamin D and vitamin B12 in your diet. So that could also affect your mood. So that vitamins, is very, very important. And we recommend that you do get an annual physical and do blood work so that you can see what your vitamin levels are. And if you are low, you can work with your doctor to replenish. Daily exercise, I can't tell you how important that is to release endorphins, oxytocins, those good feeling hormones. Very, very important for you to try to do some exercise. I'm not saying go ahead and lift weights and be a bodybuilder. I mean, that's nice too. But even if you just go for a walk around your complex, around your building, around your home, that will be helpful.
Sharon, we're at 1:30.
Oh my goodness. Okay, so we're gonna go a little over, but I'm gonna stop with my presentation and let's do questions.
Okay, hello everybody. My name is Vincent Moss. I'm the assistant for the Department of Disability Services at Berkeley College. And we have just a couple questions. I know we're running out of time, but the first question is for Bonnie. Dr. Marks, someone wrote in and said, can brain fog be permanent? Do we know yet if that could be permanent?
That's really a hard question to answer. The assumption is that it will not be permanent, but we don't know that 100%. And I wish I had a more definitive answer. The likelihood is that things will get better, that it will get better over time. But will it go away completely? I don't know. I truly wish I had an answer to that.
Okay,
And
thank you.
I can I plan on staying on top of the research to find out even more, but so I can always send research articles and links to people who have questions about that.
Okay, thank you.
Mhm.
Georgia?
Our second question is for Tracy, and the question is, what responsibility do workplaces have to make accommodations for COVID long haulers? Does the ADA or the 504 cover them?
So certainly there could be some responsibility, and we can look at this two ways. One, the ADA might apply, and the Rehab Act, usually it's going to be Section 501 if we're talking about a federal employer. 504 could apply as well for those agencies that are receiving federal financial assistance, but generally the ADA is going to apply to any private employer or state or local government. With that being the case, somebody can certainly go about requesting accommodations, disclosing that they have long COVID and the resulting limitations, and talk with the employer about those possible accommodations or your needs. It'll be up to the employer to determine if the ADA applies, and that's going to be based on whether or not the definition of disability is met. Now, again, as I mentioned before, you have to keep in mind, this is something that's new to everyone, and we're really learning things as we move forward. I think that a lot of employers are going to start receiving requests around long COVID. And so I think that if you are someone who is experiencing the effects of long COVID and you know it's affecting work, go about requesting accommodations and let the employer work through that interactive process to figure out how the ADA applies.
Thank you, Tracy. Sharon, we are out of time. It's 1:33. If you'd like to make your closing remarks.
Okay, thank you, Vincent. Thank you everyone for joining us. I'm really, really sorry. I know we had a lot of information that we're trying to get to you in a very short period of time of 90 minutes. I appreciate all of you that registered, the over 630 of you who registered for this event. We will have, our PowerPoints available for your review. We do have an evaluation that will be going out as well. I want to thank all our speakers for giving us their professionalism and the knowledge that they have with COVID-19. I also want to thank the National Rehabilitation Association Metropolitan New York chapter for co-sponsoring this event with us today. And I also want to say that for the audience who was affected by COVID-19, that there is hope. There's a lot of resources and strategies. I think the question that was given to Dr. Marks about is long haulers going to be permanent for the rest of your life? We don't know. However, we do know that there are a lot of remediation and strategies that you can use, like cognitive remediation, that you can use to kind of help in dealing with your day-to-day life. It's the first step is really for you to ask for help. So let me pass it on to Paula Lee so that she can give her closing remarks.
Thank you, Sharon. On behalf of our chapter, thank you everyone who participated. Bonnie, Tracy, Sharon, I think your input was just remarkable. I know we had a short amount of time, but I know I learned a lot today. So again, thank you. For those of you who require CRC hours, I did apply through the Commission on Rehabilitation Counselor Certification, otherwise known as CRCC. They usually prefer to look at the application after the event has occurred. That makes sense in case of cancellation. So they will probably be addressing this. Once the hours are approved, they usually send me an electronic certificate that I will then forward on to Vincent, and Vincent, whoever needed the CRC hours, or if you need other alternatives, I guess that could be worked out. But Vincent will share that at a later point. Just make sure you complete the evaluations that is required for the continuing education. It's good to have feedback regardless. So even if you do not need the hours, we always appreciate feedback. And if you have any suggestions for future topics related to disability or rehabilitation, we would love to hear from you as well. So again, thank you. It was a great day. I don't know if anyone else has comments. I think I saw in the Q&A, a lot of people had questions. Will I get copies of the slides and the presentation? So Sharon has addressed that. So just be patient, and there is recording of this event as well. Vincent, I'm going to turn it back to you.
Okay, that is a wrap. Thank you, everyone. We'll send out the recording for this event by tomorrow and the evaluation for the event. Thank you to all the speakers.
Thank you.
Thank you, everybody.
Wonderful
Thank
event.
you.